Dear friend who is watching this video, the reason for your severe hair loss may be skin fungus. There are many fungal diseases of the skin and sometimes it affects human hair and finally causes severe hair loss. This hair loss may be round or coin-shaped at first, and later it may spread and even in some cases, all the hair on the head falls out. Hello friends, I hope you are all doing well. Today I am going to talk briefly and at the same time in simple language about the fungal skin disease with dermatophyte fungi. If the topic is interesting to you, stay with us until the end. And if you are watching this video for the first time, be sure to subscribe to our channel to see more videos. Unfortunately, fungal infections are normal and common in most parts of the world. In humans, fungal infections occur when an invasive fungus attacks an area of the body such as the skin or hair and causes skin inflammation and even hair loss. Fungi can live in air, soil, water and on plants. There are also some fungi that live naturally in the human body. Like many microbes that have beneficial and harmful effects, mushrooms also have beneficial and harmful effects. Unfortunately, when harmful fungi invade the body, it is very difficult to eliminate them. Because they can easily survive on the body for a long time and infect another person. Unfortunately, fungal disease is one of the infectious diseases that causes an epidemic in public places, public swimming pools or in residential complexes, sports halls, schools, universities and especially hair salons. As I said, there are many fungal skin diseases, but today I will talk more about ringworm or scalp infection called tinea capitis. Well, let's start by saying that this fungal infection or ringworm of the head, which is called tinea capitis, for example, what does it do to the scalp and hair follicles that causes hair loss? Tinea capitis, a fungal infection usually caused by dermatophyte fungi such as trichophyton and microsporum, can cause hair loss in several ways. 1. Destruction of hair follicles. These fungi attack hair follicles and damage the tissues around them. This damage can cause inflammation and lesions in the scalp area, which leads to hair loss. 2. Inflammation. These fungi cause infection in the scalp and cause an inflammatory reaction in the skin. This inflammation can damage the blood circulation in the inflamed area and cause hair loss. 3. They may cause defects in hair growth, because these fungi damage the hair follicles and cause inflammation in the area. Even if the hair is thin, they cause a decrease in hair growth. So, if you feel that your hair growth is not the same as it used to be and it is very reduced, it may be a fungus. 4. Ulceration. In some cases, the infection can lead to ulcers on the scalp that can cause permanent hair loss in that area. In general, baldness is due to infection with dermatophyte fungi, which tends to involve the scalp and hair, and is more common in children and less common in adults. Sometimes it is caused by a special type of fungus called trichophyton tonsorens in adults. Well, how are these bald fungi transferred to the body? 1. Direct contact. Direct contact with the affected person, especially in close environments such as family, schools or kindergartens. This contact can be through touching or playing with each other. 2. Contaminated objects. Using contaminated personal items such as combs, towels, hats, and sanitary items used by the infected person. These objects can transfer fungi to the skin or hair. 3. Environment. Dermatophyte fungi can survive in environments with moisture and heat. Contact with contaminated surfaces can lead to fungal transmission. 4. Animals. Tinea capitis infections can be transmitted to humans from pets, especially cats and dogs. Such animals may be carriers of the fungus and through close contact, this infection can be transmitted to humans. But the severity of tinea fungus has different forms, which include the following. It is possible to see dry scales on the head that are similar to dandruff, along with parts of the head that have little hair loss and look like frizz. It may be in the form of black dots on the scalp. It may be a little worse and be in the form of areas of the scalp that lack hair. It may be in the form of crayon, which causes the formation of very inflamed and purulent skin lesions on the head. It may be in the form of favus, which includes yellow and sticky scales on the head. In a number of cases, the immune system is involved and baldness can cause swelling of the lymph nodes at the back of the neck. Diagnosis methods include examining infected hair with Wood's lamp, microscopic examination of infected hair, cultivation of mushrooms. The method is as follows. For diagnosis, we remove the hairs of the bald area along with some of the scales and place them as a thin sheet on a glass slide and observe them under the microscope. Inside the hair shaft or outside the hair shaft, the type of baldness is recognized. Of course, the exact diagnosis of the type of mushroom can be obtained after culturing the sample in a special culture medium, and the culture result is usually known after 3 to 4 weeks. Treatment. Treatment with oral antifungal drugs is necessary. Topical drugs such as antifungal creams and lotions only prevent the shedding of spores and the spread of the disease. But local treatment is not always effective, and you should also use oral medication supplements. Oral treatment with grisafulvan is considered the best treatment for this disease. Other oral drug alternatives such as terbinafine or itraconazole can also be used. I hope you enjoyed the video and it was interesting for you. Be sure to subscribe to the channel to see more videos.